If you've seen the news at all in the last month, you've probably heard of the OBBB, or the One Big Beautiful Bill. And the one thing you'll hear from a lot of conservative commentators, like Charlie Kirk, is that Democratic senators and a few Republican senators maintain provisions in the law to allow illegal aliens to get Medicaid assistance. But is this true? Is the United States really spending taxpayer dollars to give health insurance to non-citizens? The truth is complex, but no one wants to tell a complex story. Either illegals are eating up all of our welfare, or undocumented immigrants cost the US very little in welfare and deserve health care for being human. So let's try to answer this question using research, data, and statistics to try to stay as unbiased as possible. I'd like to let you know in the beginning here that I'm going to use the term illegal immigrant throughout the video. I find that it strikes a middle ground between the other commonly used words illegal alien and undocumented immigrant. It acknowledges the word illegal, which I find that the word undocumented immigrant tends to downplay the importance of. But I also use the word immigrant to show that these people are people, which the term alien is purposely trying to do to devalue their humanness. If that triggers you in any way, just make sure to say it in the comments down below. So the first thing to do is look at what federal law says and see if there actually is any illegal immigrants on Medicaid. The answer is no. According to federal law, illegal immigrants are not eligible for Medicaid assistance, and that's been the law for decades. Medicaid will reimburse hospitals for money spent on life-saving medical care for illegal immigrants, if it is, of course, deemed necessary as life-saving. We can assume this is supported by a large number of Americans because 68% of adults agreed that the federal government should provide medical care to undocumented immigrants during COVID-19, though only 37% agreed with economic aid. Given that COVID is not always life-threatening and that life-threatening medical interventions are always life-threatening, I think it's pretty safe to say that people are fine with this. Less than 1% of the total Medicaid spending goes to emergency care for illegal immigrants. Many sources putting the number around 0.4% for all of emergency care spending. So the amount of illegal immigrants that are getting emergency care are going to be a fraction of that fraction. But if you live in California, Oregon, Washington, or Colorado, your state gives coverage regardless of immigration status. California has extended full scope Medicaid, known as Medi-Cal, to all low-income undocumented adults, starting in 2024. First with minors in 2016, then 19 to 25-year-olds in 2019, older adults in 2021, and now all adults in 2024, costing around $2.7 billion per year. And you can of course look at the graph here on the screen to see the immense growth of this program over time. Other states like Illinois, New York, Oregon, Washington, DC, etc. provide limited services, typically for pregnancy and child services, with New York also giving care to any adults over the age of 65. So while Medicaid is a federal program, states have a lot of freedom to create rules around how Medicaid works in their state. So how does this whole bill actually talk about illegal immigrants and Medicaid? Well, it mostly keeps the status quo and just enhances a few things. Let me show you. The bill reaffirms the current law that illegal immigrants are not to get Medicaid assistance, but creates new enforcement laws and penalties for states that don't listen. For example, Section 71117 tightens the uniform and broad-based standard for provider taxes and restricts the loophole that some sources claim states have used to launder money through the federal government. For example, the Economic Policy Innovation Center provide this graph for all of us to look at for what they think California is doing. As you can see, they're saying that illegal immigrants are getting $3.9 billion of federal money in California each year. This claim has some evidence because California was forced to pay $52.7 million back to federal government and reimbursements for giving money to non-citizens. But it's important to know that in this graph, the word launder is a rhetorical tactic and not a fact, because up until the illegal immigrant part, it's legal and allowed by US law, which laundering isn't. But the OBB plans to make this whole scheme impossible without breaking the law. States who continued to fund Medicaid for illegal immigrants would start to face increased penalties and reduce federal matching funds. It would also include a biannual verification process with fingerprints, paperwork, risking coverage loss due to people just not showing up because they may or may not have those things. And the bill also cuts reimbursement for emergency care in the states that expanded Medicaid under the Affordable Care Act. So do illegal immigrants get Medicaid? Not really. They're barred from federal Medicaid, And even emergency care makes up such a small percentage of spending that's mostly negligible in comparison to the massive current deficit of the US government. Some states like California gets the federal government to spend more money on illegal immigrants, but the new bill is trying to crack down hard on this stuff. The idea that illegal immigrants are draining Medicaid is mostly not a problem. But if you look on a state-by-state basis and how certain states may be spending your tax dollars, that's a legit conversation to be had. A large part of the population blames the current illegal immigrant population on a female border czar. Does that mean something? I have an entire video legitimately looking into the claim, are women worse leaders? And it doesn't have the answer you're probably expecting. You can check that video out right here. And don't forget to fit everything you can into a reconciliation bill. Keep in mind rhetorical tactics and think controversy. I'll catch you over in this video right here.